Hints in microorganisms. Asplenic patient, that is encapsulated microbes. Organism is Streptococcus pneumoniae, H. influenza, and N. meningitis. Branching rods, that's oral infection and sulfur granules, seen in Actinomyces israeli. CGD, that is catalase positive organisms, Staph aureus. Currant jelly sputum, seen in Klebsiella. Dog and cat bite transmission, it is Pasteurella multicida. And facial nerve palsy, which is bilateral, is in Borrelia, and that is Lyme disease. Fungal infection is diabetic and in immunocompromised patients, that's Mucor and Rhizopus species. HPV, there's needle stick appearance and seen in healthcare providers. And neutropenic patients, there's Candida albicans, that is systemic and aspergillosis.